stress hormones increase, and it leads to, non-communicable diseases. It is important that we relieve or I won't call it get rid of your stress or avoiding stress, because that's not practically possible. Try to minimize or manage your stress in such a way that the last 2 hours before you go to bed, you're more peaceful. Then your sleep pattern improves, because you need to sleep at least 7 to 8 hours every day. Make the room dark, quiet, quit smoking if you are a smoker. Avoid afternoon naps if you are a person who does that. Avoid fatty food, because those who have heartburns, if they take spicy food, then it becomes difficult for them to sleep. And ensure that you avoid caffeine at least, after 5 o'clock in the evening, because that also hinders your sleep pattern. The take-home message is, make sure you have a balanced diet, incorporating more of plant-based foods, ensuring that you have a proper portion control, because you should understand each one's requirement is different. So according to your requirement, you should eat and ensure that you try to minimize on your sugar, salt, and saturated fat. This is very important. And make sure you have your sleep pattern organized at least 6 to 7 hours every day. Drink at least 2 liters of water, and keep yourself active half an hour every day, 5 days a week. This will give you an overall well-being, improving your immunity, helping you to fight against diseases, as well as keeping a good quality of life. Knowing is not enough, we must apply. Willing is not enough, we must do. I have done my part to convey the message to you. It's in your court to take it forward. Thank you for your patient listening.
So good evening. I thank Mali and Captain Vijay Kumar for the invite, and Dr. Suresh for making us all come here and talk about immunity. Our inbuilt, I think, superhero. Okay. So now that the stage has been already set talking about immunity, let's talk about the MVP, most valuable player, vaccines. So I'm going to talk about vaccines for strength, what every adult professional must know. How do I move this? Okay. I'm Dr. Madhumita. You already had the introduction before. And I'm an ardent advocate for adult immunization. That's my passion. So let me ask you all one thing. How many of you in this hall have taken a vaccine in the last 3 years? There are some of you. That's nice. Last 3 years, you wouldn't have had your COVID vaccine. No, not the COVID vaccine. Any other vaccine in the last 3 years. Okay, now the hands have come down. Okay, how many of you know about a vaccine called influenza vaccine, and how many of you have taken that influenza? Mali, you should. Yes, hands up, straight. Okay, so there are a few who know about the influenza vaccine and you have taken. I think everybody, the previous two speakers have spoken about immunity and immunity. I'm sure you would have understood what immunity is. Immunity is your body's inbuilt defense system that fights off germs and keeps you healthy. How do I enhance it? I think that my previous speaker spoke about eat well, sleep well, move your body, stop stressing over every sneeze. Captain Vijay Kumar is now stressing, I have a time 7:30 limit. So just chill, okay? So we are just chilling right now. We need to just chill a little bit. Let me talk about, before vaccines, something about the human psychology. Way off topic from what I'm supposed to talk about. There's something called as cognitive bias and availability bias. You know what I mean by availability bias? I keep showing you something, you think that is true. 10 WhatsApp message about the same thing from 10 different groups, you think that is the truth. and you start believing that. Affirmative bias. And one of the availability bias right now is, you know what? Once you ask Google about the air crash, it will tell you about hundreds of air crash that has happened, and you will start believing that traveling by plane is not safe anymore. Understand that traveling by car is also not safe. Walking on the road is also not safe. So it's the availability bias. Affirmative bias. When your brain is such a thing that it doesn't want to be challenged. It always feels that I am right. Whatever I say is right. So when you start believing that this diet is the best diet, anybody gives you advice, something different, you don't want to take it. Optimism bias. It's very good. We need to be optimistic. It's a way forward. You keep moving. But you can't be delusionally optimistic. Will you stop taking insurance because you think nothing will happen to me? I am fine. You just have a slip because of a drop of water, end up with a backbone fracture, and you don't have an insurance. What would you do? You cannot have an optimistic bias like that. Denial. We just don't want to hear anything bad. We always want to hear good things. How many of you will accept that you have a disease? No. How can that happen to me? It's not me. Denial. We never accept things. And the last and most important thing for doctors, patients always love to hear what they want to hear. If I say for a hernia, you need to undergo a surgery. No, give me something without surgery. Maybe like this tea. I take a tea and the hernia disappears. That's how we are. There are a lot of myths about health and medicine. We always think vitamins are wonder drugs and that is going to improve my immunity. In 3 months, my immunity is going to come from 0 to 100%. Vitamins are not wonder drugs. We need to worry about health only when something goes wrong. I am perfect, fit and fine. Patients who come to the hospital tell me, Doctor, I've never been to the hospital. This is the first time I've come to the hospital. We all do that. And we think antibiotics are miraculous drug. We don't need anything. We have a fever, we just take, as it was discussed, azithromycin. We take because antibiotics will solve all our problems. And the internet is a treasure trove of authentic information. You ask the WhatsApp doctor or your neighbor, they will say, hey, this was given to me. You take this, you will be fine. That is how things have become right now. And money can buy good health. Yes, we all think that, but how long will the money buy us good health? And like Dr. Suresh said, and now I'm going to go into all of these attitude biases, because the more and more I show you the same thing again, you will start believing what Suresh and me said were true things. So you will start accepting certain things. Why do infections happen? And how did it happen? And why did I get TB? Why do it happen? Why does it happen? If you know, the number of cells in your body is about 10 to the power 3 trillion. The number of microbes in your own body is 10 to the power 9 trillions. So you don't need anything from outside. You have everything inside you. Whether they behave good with you or behave bad with you is the way you treat them. So I always say, you are a mirror. It will show what you are. If you have bad habits, your microbes will show you bad habits. And so it can happen. It is there in the air. Anyone can get. And how can I get TB? I stay in a AC room. I travel by Benz. How did I get TB? I think COVID would have taught you all. There is nothing that there is a disease of poor or disease of rich. Infections can happen to anyone across any borders. Not that you are in India or you are in the US. You can get infections everywhere. Okay? So it's like saying that, what is the difference between cold and COVID? If I get it, it's cold. If somebody else gets it, it's COVID. Not my problem. Okay. Some truth about antibiotics, because any infection we want to take, if you think it's a fever is treated with antibiotics. Actually, fevers require paracetamol, not antibiotics. The tragic irony of the miracle, antibiotic way back was discovered by somebody called as Alexander Fleming. And at that time, there were a lot of people dying because of a lung infection, pneumonia. And he found this wonder drug called penicillin. It's still available, one of our cheapest medicines in our armamentarium. But it's of no use because we've been misusing antibiotics. And all the bugs, Darwin's theory of survival of fittest, all bugs want to live. So they've adapted to your antibiotics. You keep giving me, I will become more stronger. Because you've been feeding so much of antibiotics into the bacteria. And along with that, you've been causing self-harm. I think Suresh mentioned, there's so much of self-harm. Your good gut bacteria are now becoming bad bacteria and causing cancers. Where have we reached? And this problem of self-medicating is something which will never stop. So what is the common sense way to good health? Like Newton says, for every action there is an equal and opposite reaction. Nowadays we have to add plus social media over action. Okay? Whatever I say will go on social media. Put it on social media. Probably the only way to prevent infections right now, including antibiotic resistance, is adult immunization. Way back when we started adult immunization, actually this concept of adult immunization, some 10 to 12 years back, you Google, because even I also used to Google, when you write adult immunization, this was a picture, because there was nothing like adult immunization in India. Immunization means you immunize kids. So why adults require? Because as I said, we have very optimistic bias, nothing happens to me. But now, there is a social media overreaction, okay? If I put Kamala Hassan in the photo taking a vaccine, all of you will take flu vaccine today. Today! But that's how COVID vaccine happened. You saw Rajnikant, you saw Hema Malini on picture, your dream girl was taking vaccine, we all took the vaccine. Imagine, it was safe water, where a lot of infections came down. And after safe water, it is vaccinations which actually reduced the mortality and morbidity. There were four pictures that Suresh showed. One was about influenza, how the influenza pandemic came down. Polio, morbidity. Just imagine how many of us, if we didn't take that 2 drops of polio vaccine, how many of us would have been walking with a single limb or limping? Okay? None of us do that. And vaccines also reduce workplace abstinence. If you get flu, you're not going to go to work. You're going to lose your money. But if you don't have that problem, it improves productivity. And vaccinations also reduces families' healthcare cost and provides financial protection. Obviously, if I don't fall sick, I don't have to pay Dr. Madhumita or Dr. Suresh's fee. I stay at home, I am fine. Right? Why do we vaccinate adults? Imagine that the number of deaths in 2000, this is a paper in 2000, said that there were 60,000 adults who died of vaccine preventable disease, which was 200 times more than what was seen in children during that year. Because children were all vaccinated, so they didn't die. But adults died because we are not vaccinated. Why am I talking about this vaccination? As Suresh said, the child is not born with any immunity, but the immunity grows because the child has some vaccination or there are some natural infections. So the immunity keeps growing. But after a certain age, the immunity also declines. Obviously, we're not going to fit into what clothes we wore as children, right? We need different clothes. And like Suresh said, we become balder, we go on to diaper, we have gray cells. So the immunity also grays. So what we call as immunosenescence, okay? And this is determined by your genetics, what other comorbidities you have, what physical exercise you do, what nutrition you do, what nutrition you take. So it is determined by all this. There is a difference between your chronological age and immunological age. Too many words, jargons. But yeah, so a same person of your age who's sitting next to you may be better immunologically than what you are because of your own exposures, what you have done all throughout your life. So you need to understand that along with your physical activity, eating, healthy eating, avoid smoking, screen for health condition. Every year I go do master health checkup. What does it say? It says that, your hemoglobin is fine, your vitamin D is low, your this is low, that is low. What did you do to protect yourself? I'm washing my hands, I'm wearing mask, I'm doing everything. But the base of this pyramid is vaccination. Like the way you vaccinated the child to grow with a good immunity. As an adult also, you need certain boosters to keep boosting this activity. This immunity. So what are vaccination? How do they work? Why do they need them? And like the owl, I have so many questions. First thing, we will eat pani puri but not think about the side effects. But if I say you have to take a vaccine, I'll say what is the side effect? Okay, we don't bother about the effects of things which have good effects, but we will ask only about the side effects. Who needs them and when do they need them? So why vaccinate adults again? Coming back to the same question. Protection from some of your childhood vaccination can wean off over time. You're like your TT. So like Dr. Suresh said, I get a wound today, I get a scratch today, I take TT. Tomorrow I get a scratch, I will take TT again because I've been told that TT can kill you. As long as a dagger does, hang above your head, we don't go and take vaccine. That's how, when the death dagger of COVID was on our head, we all went and took the vaccine. But when we think that there are certain vaccines which can build your immunity, we still don't want to take them. There are certain viruses and bacteria which change over time. So you need repeated vaccines for them. Your immune system as you age goes down. So there are certain vaccines that you need for that, which you might not have taken as a child, like influenza and pneumococcus. There are certain immunocompromising condition, or, stress is also an immune depleting, I would say. Immune depleting condition is stress. Just stress can get down your immunity. And that's when you get something called as herpes zoster or Aki. So which is basically a reactivation of your childhood chicken pox. You will get a line of blisters and it is pretty painful. And as an adult, you can infect others. I'm sure if you're following the news, there is a lot of news about measles in US. Why is there measles in US? Because many of them were not vaccinated. When we ape the West and we think that we should do a lot of things, don't ape the anti-vaxxers. Okay? Vaccination is very, very, very important. So there is outbreak in adults, measles in adults, because they've not been vaccinated. So there are a lot of deadly diseases which can be protected by vaccination, of which there were earlier 14, I made it 15 and I added a COVID vaccine. And with COVID vaccine, I'm sure you know that it has protected us. And today, if the pandemic was stopped, was probably because of the COVID vaccine. So how does these vaccine works? These are basically a protein molecule or a small part of the virus or the bacterial antigen, which actually are modified, and you develop immunity when you are vaccinated, because these vaccines imitate a natural infection. Okay? And when there is a difference between infection and illness. Infection is basically your body is trying to look into that antigen. Antigen means it's a particle which is going to mount that immune response. So this antigen mounts an immune response, but you don't get the entire spectrum of what would happen if you had a natural infection, like influenza. Like when you get influenza, I'm sure all of us would have had one influenza episode in our life, like you have severe fever, joint pain, running nose, headache, a full-blown influenza. But when you take a vaccine, probably you might have a single day of fever, because that's mounting an immune response. So that's how vaccines work. And remember, vaccines are to prevent disease. It's given in a healthy individual, Large number of people can take it, and it acts as the individual level and sometimes at the population level. I'm sure during the COVID you would have heard about herd immunity. If you vaccinate a lot of people, others also get protected. So it helps in a larger population. And these are well studied, so they are highly safe, and you have minimal side effects. Whereas medicines is what you give when you actually have an infection. So it's given to treat a patient who is sick, and it acts only at that person. So if you are sick, you get treated. So what are the vaccines? I don't know if it's clearly visible, but this build-up was to say that there are so many biases. I'm showing this attitude bias again and again, saying that you need to change. There are a lot of evidences which say that vaccination improves your immunity. So what are the vaccines as an adult that I need to take? First is an influenza vaccine. Who can take it? Actually, influenza vaccine is given to anybody above 6 months of age. If you are 50 and above, definitely yes. The 30s and 40s, if you have any risk factors, like you have diabetes or you have some lung disease, kidney disease, so you have any risk factors, you need an influenza vaccine. And if you are pregnant, definitely you need an influenza vaccine. And influenza vaccine is taken yearly, what we call as annually. And this virus is something which keeps mutating, or it keeps changing. So the vaccine also every year changes. You get new vaccine every year. So you need to take influenza vaccine every year. Second is, I said shingles. Shingles is what I call as aki. Okay? I don't know, in Hindi it's called as dhapad, and also something called as nagin. Do you know how painful is shingles? Has anybody in this auditorium ever had shingles? Okay. There are few women. You might have had labor pain. The shingles pain is worse than a labor pain. So you can imagine how painful it could be. And the pain doesn't stop after the blister disappears. The pain could linger around even for 3-4 months, and what we call as post-herpetic neuralgia. It's really, your quality of life is really spoiled because of the pain. So am I somebody who can get herpes zoster? Actually, the study says that 90% of all adults above 50 years would have been exposed to chickenpox at some time in their life. And this herpes is basically reactivation of chickenpox. So 1 in 3 people can get herpes zoster at any time in their life. So right now we have a wonderful vaccine called as Shingrix, which it comes in 2 doses. You need to take 1, followed by after 2 months you take the second shot. It is for anybody and everybody above 50 years of age. Okay, and this is something again, we talk about cocooning. Why should I take? I'm healthy, the healthy bias again. But if there are people in your house who cannot take the vaccine, you are going to form a protective ring around them. So you don't get sick, the other person also doesn't get sick. The other vaccines, I think Dr. Suresh mentioned, DPT, tetanus. You keep taking tetanus shots every year. But things have changed. There is another thing called as pertussis. You have a combination vaccine, Tdap, which is tetanus, diphtheria, and pertussis. As an adult, anybody above 18 years of age. I'm sure many of you would have kids or grandchildren also at this point, and you would have seen in their schedules there will be a lot of medicine at 6, 10, 14 weeks, DPT, hepatitis B, influenza. I think now we don't include influenza in the kit. Yeah, DPT, hepatitis B, IPV, which is, we don't give any more of the oral polio in the UIP. We give injectable polio vaccine. Oral polios for kids are still given as your pulse polio programs. So these are vaccines that we have taken as child, but as an adult, you need 1 booster. So at one point, any adult above 18 years requires a Tdap vaccine. The fourth and the most important vaccine is a pneumococcal vaccine. You know, this is an infection, it's a bacterial infection. Like influenza is a viral infection of the lung. Pneumococcus is a bacteria which causes lung infection. And in elderly, there are 4 times than that of the younger population. And older adults have a higher rate of hospitalization and are more likely to die as a result of community-acquired pneumonia. This is a bug where Alexander Fleming got the miracle antibiotic. It's still useful, but if you get an infection, it can be very serious. You now have a vaccine which can prevent this infection. There is something called a severe form of pneumococcal infection, which we call as invasive pneumococcal infection, which doesn't just affect your lungs. It can go into your blood, it can go into your brain and cause brain fever. So to prevent that, you have a vaccine. So you need 2 doses of this vaccine. They come in different forms. Talk to your doctor about the pneumococcal vaccine, and depending on your age, depending on your risk factors, they will tell you which vaccine to take and when to boost that vaccine. Hepatitis B vaccine. I'm sure some of you would have heard about it. Hepatitis B is a virus which spreads through blood transfusions. It spreads through contaminated needles. So there is a vaccine to prevent this. Why should I prevent hepatitis B? Because hepatitis B can progress to chronic liver disease. It can also progress to liver cancer. So you have a vaccine which can prevent a cancer. Similarly, there's another vaccine which can prevent a cancer, which is HPV, human papilloma virus vaccine, which generally is recommended in children. It starts from children. So 9 to 15 years. Now they have extended till 26 years of age. You can take both girls and boys, and they require 2 shots if they are less than 15 years. More than 15 years, they require 3 shots. Beyond 26 years, there is a limited advantage of taking the vaccine, but this is a vaccine which will prevent cervical cancers. So, according to my age, what do I need to do? If you are between 19 to 50, if you have any immunocompromising conditions, like you have HIV, I don't think any of us have. If you are on steroids because of any other problem, because steroids reduce your immunity. So you need to take 4 vaccines. 1, the influenza, Tdap, hepatitis B you can take, and the 4th one is pneumococcal vaccine. Right now there is recommendations for certain chronic health conditions in people between 90 to 50 to take the pneumococcal vaccine. Anybody above 50 can take all the vaccines. But there's always this vaccine challenge. I spoke so much. I don't know how many of you will go back and take, but the women, if you ask them to take Botox, they don't fear those injections. But the minute you take a vaccine, they fear that needle. Okay? It's like the COVID vaccine. Vaccine situation in India is like looking for a bride for marriage. First, you're not ready. Then you don't like any, then you don't get any. Those who got are unhappy thinking maybe the other one would have been better. So it's like, now COVID, there are 3 cases, everybody wants to know in the WhatsApp, is there COVID vaccine available? When it was available, that time we didn't take it. But now we want to take it. And this is another thing that WhatsApp spoiled us. There are so many people who died because of the COVID vaccine. We never looked into the number of people who got protected, the number of hospitalization that reduced, the number of death that reduced. But we thought about only the side effects because we always correlated everything to the vaccine, which may have been just a bystander. There were news which said that HPV, the lady who took the HPV vaccine died. You read the news inside that she died because of an accident, not because of, she was hit by a motorcyclist, not because of the vaccine. But that's how news are published. And we think that that was a causative agent. And like Suresh said, Google is there. Anything and everything, you ask Google because it makes you feel that you were doctors since 1998. And even if you say you don't have any symptoms, Google will say that is one of a symptom, not to have symptoms. And what is the most worst thing about social media? It will show you something else which is not the truth. And that is what happens in social media. So remember, never compromise on health. When you may have a cheaper, or your budget may be low, but that doesn't mean that, you should use it on buying gold and not vaccines, okay? Because wealth is nothing when you don't have health. So change in belief should precede behavioral change. If you don't worry about health, it is going to go away. And that quote was from Goethe. I have also mentioned it. See, again, when you have group of doctors, they would say the same thing to make you believe that that is the truth. Knowing is not enough. We must apply. Willing is not enough. We must do. So like the owl which asked me too many questions, don't forget to take your vaccines. Otherwise, you will become an endangered species. Feel free to ask any questions that you want. Thank you.
Hello, I'm Dr. Lakshmi. Thank you so much for inviting me, Dr. Suresh and Captain Vijay Kumar and Sir also. So it's a great opportunity to have such a lovely audience and so many people attending online also. So it was a pleasure seeing the income generation by doctors, the list of doctors, your list of doctors. I was desperately searching for my specialty in that list. As usual, I couldn't find it because rehabilitation is a less known specialty. I would say we have been hidden. The corporates have hidden us because we are the doctors who help people to get out of the hospital faster and prevent them from getting back to the hospital. So I told this to a patient and he asked, well, then why did they hire you? So that is what we do. So we try to cut short the length of hospital stay, and in case you get discharged, we help you to prevent readmissions. So that's all in a lighter sense. So in the Western world, this rehabilitation medicine is a well-established specialty. Because in India, the health preferences were different till now because we were poor. And we didn't have enough money to spend. The government doesn't have enough money to spend on the health system. The priority is to save lives in India. So, but the situation has changed, at least in the private hospitals. So the quality of life is what matters for us. Rehabilitation is a specialty which takes care of the quality of life. So the specialty is blooming in India now, especially in the private sector. So this, through this presentation, I will be focusing on how exercise helps to improve your quality of life, improve your work performance, and all these things. Exercise helps with longevity of life. That means it helps you to live longer. Everybody knows that. And this is the approximate age that you can gain by doing regular exercises. So living longer is not enough. You need to live a good quality life, no? So you should be able to deal with all the lemons that life throws at you. So you need to be able to face life with confidence and live a blessed life. So how does exercise help with that? So somebody did a study in Bristol University. So they studied 200 employees working in 3 organizations and evaluated their performance at work. For those who were exercising, they compared the people who were not doing a workout before attending the job and those who did a workout before coming to the job. These were the findings, that 21% had higher concentration They had higher chance for finishing their work on time, higher likelihood of working without unscheduled breaks, and 41% had a feeling of better motivated to continue to work. So that was the effect that they could find. But unfortunately, so many of us, 1 in 3 women and 1 in 4 men are not engaging in regular physical activity. So that kind of correlates a bit. We are on the poorer side when Madam asked for the number of people exercising regularly. So I'm running a cardiac rehab program at Apollo Greens Road. So this is these are the gains that the program gives. The program includes exercise, diet, and risk factor control. So this, by doing regular exercise, you can see all our organ systems get benefited. And one among the organ system is our immunity. So it reduces inflammation and reduces inflammatory cytokines. So you can see that all the organs are getting benefited through not only exercise. As you can see, don't confuse that cardiac rehabilitation is just about exercise. It also includes nutrition and risk factor control. And one most important thing, stress control. Sleep, 5.5 hours of sleep is not at all enough. 7 to 8 hours is recommended. So the wealth you have gained, you might lose through the health if you get hospitalized. So try to save money by sleeping more. I've seen young people getting heart attacks just because of the poor sleep schedule and increased stress. People in their 40s and late 30s are becoming more and more common nowadays. So this is another study by Niemann, which was published in 2018. So they studied multiple factors with regard to exercise. So they could find that there is increased immunity, and I'll talk about in detail. So the one thing that I want to mention here is what they found is that there are some nutritional interactions. If you're doing a workout, if you're having water, they compared people who had water in between exercise and you had a bit of banana in between exercise. So those who had banana had better, less inflammation post-exercise. So little bit of carbohydrates during the exercise helps. Make sure it's not junk, but something healthy like dates or those who are working out regularly, please have it. So it's better than water alone. So exercise reduces the stress hormones. It's a two-way. It kills all the bad cells. So when our immunity, basically the function is prevent an external attack, and it should not do a self-attack also. So during exercise, what they found is that all the harmful, the attacking ability of the body increased. That means if a tumor cell or if a pathogen enters the body, if a bug enters the body, our body was able to resist it better. And at the same time, the inflammation in our body, the basic cause of heart attack is also inflammation, that swelling that happens within the vessel walls of the heart. So that swelling and the inflammatory tendency of our body came down. Vitamin D deficiency, all this is linked to the inflammation. Autoimmune diseases are on the rise because our body has started attacking itself because of our lifestyle and the gut microbiome changes. Our ancestors were used to this twice daily eating schedules. They were busy at work. They never got time to eat on time. So our gut bacteria is used to only twice a day eating schedule. When we put too much of food inside, the gut microbiome is getting choked and not having enough rest time. That is the concept behind intermittent fasting. That is also helpful. So actually when we consider workout, there was a moderate workout is better. Rather than suddenly deciding one day to join the gym and start working out, it actually increased the chance of infections. That is what this study found. There is a J curve where if you suddenly start overdoing, it can harm your body. So keep doing at a moderate intensity. That is the best. So what is regular? About 30 minutes 5 days a week of moderate intensity. If you don't have time to exercise 30 minutes of aerobics every 5 days, you can also do high intensity training, 20 minutes, more vigorous exercise, at least 15 to 20 minutes a day is a must. So, it is not only aerobic. When I ask cardiac patients about their exercise, all of them says that we were going for a walk regularly. When I ask them how fast you were walking, they would say that I used to walk very slow or at a moderate speed. That is not enough. You should feel some exertion. The criteria is that when you exercise, you should not be able to sing a song, but you should be able to speak. That is the correct level. So it should not be too light, it should not be too hard. That is the moderate level of exercise. And doing it for 30 minutes is what is recommended for aerobic training. Aerobic training means cycling, walking, jogging, anything that you can sustain for a longer time. The other type of exercise is strength training. Strength training means a little bit of weight and less repetitions. So what the muscle builders do, but you can do it with a lighter weight. They have done studies saying that the strength of your thigh muscle is the one decisive factor which determines how fast you come out of the hospital once you get hospitalized. So having good thigh muscle strength, especially in the elderly people, they get out of the hospital faster. So because of the busy schedule, if you find it hard to work out on a regular basis, I'll give you some tips. So color walk is a strategy. Color walk is just taking one color, choosing one color when you at the start of the walk, and you try to find the color in the surroundings. If you walk through a road, you just try to find the yellow color wherever it is, and it's like a color walk meditation they call, because you're not supposed to use your phone, you're not supposed to think about anything else, just about the color, and just focusing on that, living in the present. So it also helps you to walk longer. It improves the cardiovascular fitness, lower the heart disease risk, reduce stress, increase energy and mood, better quality sleep, stronger bones and muscles, improved immune function. For all the CEOs, please take good care of yourself, then only you can manage well. And you can be more productive if you exercise regularly and sleep well. And these are other strategies. If you don't find time to exercise, you can just integrate it with your daily routine. We all take bath daily, so you can just do this is something called kitchen sink exercise. While people are cooking, especially elderly, they were encouraged to do these exercises. It's simple and in standing. You can see those 4 pictures. You can do that in the kitchen sink, near the kitchen sink. So like that, integrating it to your daily activity. Do some spots like while you are brushing or taking a bath. It's an easy way. So it will make sure that you will do it daily at least. So another thing is interesting thing is exercise snacking. We all go for a snack in between when we are tired at work, we just go for a tea and come back. Instead of having the tea, you can just take a round of exercise and come back. That is a new recommendation. Sitting is not new smoking, of course. But exercise snacking is a new way out, where you are exercising from 10, it can be anywhere from 30 seconds to 5 minutes. So it need not be a very long time break. And it could be just climbing the stairs and coming back, or just going for a round and coming back. So climbing stair in the sense, if you climb stairs, you are exerting more, and when you are on the landing, you are still exercising at a lower intensity, and then you are climbing the ramp, it's at a higher intensity. That is what is called high intensity interval training. So jogging and walking in between. Not really stopping in between, continuing the exercise, but at a lower level. That is called high intensity interval training. That is the most beneficial. So we do have a cardiopulmonary rehab program at Apollo. So anybody with heart can join. So you are welcome to make use of the services. We have both direct outpatient program and tele program as well. Tele, it's not a physiotherapist doing online physio, but we teach people who do exercise at home, and the doctors will monitor and recommend the progression. Exercise sessions are well monitored and ECG monitored sessions. Thank you so much.
What a fascinating evening. I think most of us gained and we'll take care of health now. Due to paucity of time, so many questions have come. We have over 720 viewers watching it online. Sorry, we are unable to take any question today, but we'll try and answer. I can assure you all the questions what you have come, most of the things have already been answered. We'll share this link with you. It's already available on YouTube. Because of paucity of time, we already overshot 7:45, hence we are not able to take any more questions. Now I took Mali to please come on to stage, do the honor of giving more books for them to read, management books. They give us a lot of thought on medicine, and maybe Sundaram, you can join us on stage. Come in front. Thank you, doctor. No. Thank you so much. Amazing. 710 is a good number for viewers, I think. We promote it on YouTube, so you'll get more and more. All of you, I think, will get individual training also as RS. It's all about management. People who spoke combined with the video. Vijay is planning an article on this. So sometimes your article also published. We do that. Functioning actually promote. Come with the transfer.